everybody will look at me that how quickly I can finish. So don't worry, I'll be very quick. I am from Government of Maharashtra. We are implementing a project for all the government medical colleges in Maharashtra and its attached hospitals. In Maharashtra, public health and medical education is separate. So this project is for the medical colleges. So there are 14 medical colleges and 19 attached hospitals. So each hospital will be computerized, and the architecture we have chosen is a distributed architecture, so that each hospital is self-sufficient, as well as the data will be also converged at a central location in Mumbai. To come to this stage, it's a long journey. It's about 10 years now. It started in 1999. But fortunately, we have reached this stage, and Hewlett Packard is our service provider. The software is from Amrita Technologies, Cochin. We had technical consultant L&T Infotech. Also, we had the good fortune of having Dr. Pathak from IIT Mumbai as our advisor. And we have a strong steering committee from the secretaries in the government. And then there are the other committees. It takes a lot of time. So these are the timelines, and I don't want to go into detail. But this project is going to be completed by next year. The model is build, own, operate and refresh, so that we don't buy any equipment or software, we buy the services. So we pay for the services which we receive every month. So that the government, there is no upfront payment, and the benefits are assured. The project cost initially it was 180 crore, and after the pilot we realized that the computers were less in numbers, so the cost was increased to by another 93 crores, so it is about 273 crores. The model is again divided with this fixed cost and the variable cost. Transactions, OPD, IPD and student registration. Now, pilot phase at Grand Medical College, which was one of the most complicated sort of institute, that is complete. And now Pune, Nagpur, Aurangabad, as well as the 3 hospitals in Mumbai, they are also completed, and another 3 institutions are on the way of completion. The expected benefit is, it's an integrated project for the state. There is going to be a unique health ID for the patients who are coming. So the citizens who are coming in the hospital for first time, they will have a single or the unique ID which will remain throughout their life. Then the creation of electronic medical record. So the basic theme of our project is electronic medical record, which will remain available throughout life and serve all international standards. There will be better utilization of available resources. There is going to be avoidance of pilferages, time saving for patient, doctors and institutions. Avoidance of repetition of diagnostic tests. Many times the study says that 20% of the tests are conducted because the data is not available. So again they are conducted because the patient don't carry those test results. There is expected efficiency gains at all levels. There will be lot of data which will be used, analyzed for administrative purposes and for policy making. It will be also used for research. There will be cost saving. Overall cost saving, the studies all over world, they say you can save by implementing IT about 30 to 40% of costs. There are going to be sort of avoidance of medical mistakes. There is ground for clinical trial and research because we have the data which is of international standard. The future possibilities are telemedicine and e-learning. This is just I picked up from the web. The global clinical trial industry is a $10 billion industry. Contract manufacturing and research is about $125 billion industry, and our share is just 500 crores. The challenges in our project was, one of the thing was customization. You know, I was hearing some of the speakers. Now, challenge is that the doctors are not IT savvy, and IT people, they don't know the medicine. So many times during customization, our doctor used to say that you do this. And IT people were saying, yes, we can do everything, whatever you ask. If you want left hand drive, we will do left hand drive. Right hand. Or you want a steering in the center, we can do that also. So many times there was no one or not a committee or group of people who can decide what is the right thing to do. So that is the problem probably, that why we are not able to sort of, or this IT in healthcare is not picking up. The mindset of the users you have heard, that is always there. Old equipments. Most of the government hospitals, they have old equipment. So to change those equipments, X-ray machines are old, or the diagnostic biochemistry machines are old. So if you want to interface, you have to change that. Top-down governance. Some ministers or some policy making is very strong and you get the results. But many times, if the secretary or the minister is not interested, the project fall apart. Old infrastructure. The buildings are old, you change the layouts. There are several problems in the old buildings. So those are also the hurdles in the project. Lack of flexibility and freedom in implementation. Now in government, always it is there that you don't get that kind of freedom. If you want to change even a small thing, it's very difficult. Because the budget is fixed, the decision makings happen at the most highest level. So these are also problems. Complexity of the process. The processes are so complex in the government that many times we try to copy the manual process into the IT. We don't do the simplification or business process re-engineering. So these are the major challenges. At very few instances, we really sort of sat and decided to simplify the processes. I can tell you 90% it is whatever we are doing, we want to just convert it into IT. But that is not real IT. Multiple GR, government resolutions. I can tell you there are several government decisions happening, and many times they are conflicting to each other. Finance department GR, the IT department GR, the medical education department GR. So all these things, they complicate the process. So these were really challenges. This is just the international scenario, which you know that Obama is pumping so much of 2 lakh crores in 10 years for this kind of IT in health. He has sanctioned 38,000 crore in, I think, February. This is what we thought that no state government has done, what government of Maharashtra is doing. Of course, I heard that Tamil Nadu is also going ahead with that. But I am sure that it's a matter of time that benefits are assured. And real benefits will start when all the 19 institutions will be integrated or they will be computerized. And I'm sure that there will be generation of income also from this. The future technologies, fingerprinting, PDA, computer on wheels, handwriting and voice recognition tools, use of mobiles, and availability of teaching material in the HMIs. So it's a long journey, and many times you need a strong team which is remain throughout the project, at least in the initial stages, which will take the project to certain level. And then the sustainability. So someone was saying that it has to be implemented fast also. So I feel that whatever up till now, whatever we have done, I welcome all of you to come and see our efforts. There are many mistakes also, there are many challenges also, there are many things which are not completed yet. But I can tell you proudly, I have seen the NHS computerization, the computerization in US, Singapore and Malaysia. I can proudly say whatever we have done is really worth seeing, and anybody who wants to come, please welcome and see the effort what we have done. Thank you so much.